the dialysis center itself is like a second home for them, because nearly in every week for more than 12 hours they will stay with us. We don't know how the chef will cook, how the food taste will be. So, but the way of presentation, once the food comes to onto our table, it will attract us. It will mentally prepare our mind that yes, the food will be good, because the way of the decoration they made in the plate.
So your day and life as a quality manager, can you describe to the younger people how your day goes? How many meetings you have? What time do you start? Do you even end the day? Do you even go home?
Once the problem is identified, then it is easy to focus on the solution. So if the problem is unidentified, then we can't look for any solution. It is like a open-ended question only. We never achieve the goal of eradicating the intradialysis complications completely. Everyone knows well about the value of water, how important and how value the water is in our life now. So especially when it comes to the dialysis, most of the very few people know how much water is required, but only the people who is working in dialysis, they know especially how many liters of gallons of water we are consuming. So basically, the first of all, the technicians has to understand that the dialysis means it's not about just doing the priming, cannulation and termination. It's no more any standardized care in dialysis. Now it should be like an individualized care. So we have to treat every patient is a unique and individual, and we based upon their patient's condition and their comorbidities, we have to be deliver the care. Basically, every organization have the annual operating plans. Basically, they are having the AOP, that is annual operating plans for operations, for R&M teams or for financials. But in my organization, along with all other departments, we are having the annual operating plan for quality also. Yes, we do the same thing. Even we will have the system where every day morning once we developed the tool that is like a self-assessment checklist tool we have developed. And most important thing nowadays, the technicians also need to upgrade their skills in multiple aspects.
I am going to say hello to you in Telugu. Yella enaru. And I want you to tell me something in Telugu which I won't understand, but maybe some of your viewers will, some of our viewers will.
So it is like, anta andaru bagunnaru means all are fine. All are fine. In Telugu, it is like andaru bagunnaru.
Good morning, everybody at Nephlearn. Good morning to all the dialysis technicians, the RMOs, the nurses, and so many other people who like to listen to our channel, Nephlearn, on YouTube. And our very first podcast is already out with Kishore. And I'm sure you must have enjoyed that first podcast, which is why you are back again today with our second podcast with us at Nephlearn today morning. So, what is it that we are doing here? Well, the podcasts are a series in which, as an assessor of dialysis units, I have been to many units across the country. And wherever I go, I have seen excited people telling me about what they do, how they do it, and they're very proud sometimes to display all of this to us. I would like to share their stories, their insights, their learnings with all of you across the country and even beyond the borders. And so, we are here with our second podcast today at Nephlearn Talks. And this today with me is a very, very special guest whom I'm very excited to interview, because I actually saw him at work and I saw his unit and I was amazed at the amount of fine detailing, minute detailing to quality that they have paid attention to. I'm talking about Mr. Sagar Sakam. He is the business quality lead. Yes, that's right. The business quality lead for Apollo Dialysis Centers. And he runs a whopping 135 centers. Yes, you heard that right. 135 centers under his belt with his team, and he is auditing their performances every month. So, Mr. Sagar Sakam, I welcome you to Nephlearn Talks. And I would like you to briefly introduce yourself.
Yeah, thank you very much, and I am too very good morning to everyone, and I am also too excited to be part of this Nephlearn program and detailing this podcast. So thank you, Ashwini madam, for giving this the platform to discuss and to share my experiences with the whole technicians and the nurses across India. So basically, so as you said rightly, so currently we are having 135 dialysis centers, and I'm taking lead as a business quality lead. And under me there are 6 employees. I mean, like a 6 team. I'm having that regional team where they are based out in Andhra Pradesh, Chennai, Tamil Nadu, and in Assam, Bihar, North region at the Delhi. So this is my team. Along with my team, so I'm taking care and ensure that we are delivering the best quality service to our dialysis patients.
Wonderful. That's very nice to hear and very reassuring and confidence building to hear that you have a good team backing you up. But Sagar, tell me your journey as a technician. You started as a technician doing your BSc nursing, you had told me. And today, in 15 years, such a short period, you've reached an amazing height. Can you tell me your journey, how you studied, what you did, what were the things you pursued in your education?
Yes, ma'am. So basically, I did my graduation from nursing. Then post my graduation in nursing, with the interest, I have done industrial and organizational psychology. So then post that, as I am interested much, as I am entered, see, once I completed my graduation in nursing, I entered into the field of nephrology as a dialysis nurse. As a renal nurse, I started my career. Then later on, I learned so much. Then I've been promoted as a technician or as an in charge of the unit. Then even though I want to, as I'm continuing and choose my career in nephrology, so I thought to learn more about the in-depth knowledge. I want to gain in-depth knowledge in the field. So I did my PG diploma in dialysis also.
Okay.
So then later on, as after in the period of 5 years, from renal nurse or dialysis nurse, I become the technician. Then I become the unit in charge for one of the bigger unit in medical college in my previous organization, which is Bibron Medical India Private Limited. Then later, as I'm progressing, then I came towards this field as a trainer. I promoted from senior technician, then I promoted as a quality trainer. Then from quality trainer, then I become the quality manager. So as the career is progressing, then I completed my MBA in healthcare management, and I done few certification programs in healthcare quality management and Lean Six Sigma certifications, and I'm also having the certifications in CQM. So I thought to learn continuously to progress. So I want to learn. I'm eager to learn because to compete in this technology world, because not only in the dialysis field, so to compete and to learn new things and about the field. So I'm continuously trying to learn new things.
Wonderful. Actually, that's a very important point you have made, that constant learning is very necessary and we need to upgrade ourselves. There's so much change happening around us. Yesterday, somebody called me and said, "Do you want an AI chatbot for your website?" And I was, "Oh, yes, that is necessary today." So things are changing. We need to change with the times. And this is a very important point that you've pointed out. Your journey really has been incredible, right? And I wanted to ask you, you spoke about data metrics when we were talking with each other and when I visited your unit. Data is important, and data gives you a lot of, they say in quality fields that what is not measured cannot be improved. And I think you can give some examples regarding this, how you believe in data and how you've used it to improve your unit.
Yes, see, absolutely, madam. See, earlier when I am as a dialysis technician start my career, so I too don't know much about the data, why we need that much analysis in the capturing. See, because every technician, we are writing the files and we are checking the vital signs and everything. It is a daily routine, but we never see it into it in deep. So once I become to this position as a quality manager, then I realized, when I'm progressing in my career, then I realized how much important it is to maintain the data. It is like a technician's maximum, they will think, okay, writing the records is just for the records purpose only. It is like a documentation purpose for doctor or for patient. But if we will go in detailed, The each and every data what we are capturing give us the opportunity to find out some solutions to the problems, to bring out the better clinical outcomes.
Wonderful.
So this way, so example, if I will see, we are gathering lot of data sometimes, and I want to tell to the technicians that, so documentation is very much important in the healthcare field. So because it is not only just to avoid the medical legal issues, the documentation is not only the point of avoid medical legal issues, it is also important to gather some information so that we can provide better care to the patients.
Correct.
Through that analyzing that data in detail. So for that, monthly, see, when it comes to me, so monthly we are capturing the huge number of data related to the patients, including their vital signs, their comorbidities and everything. So along with that example, I can quote that how the data analysis will help to the technicians to bring the clinical outcomes. So example, in any dialysis clinic, if we will go and ask them, in the last 1 month, example in your center with 10 beds, so in last 1 month, how many intradialysis complications you handled?
Correct.
So, I mean, they handled much in daily. Maybe if they are with 10 beds, they are doing 30 sessions per day. So out of 30 sessions, maybe 2 intradialysis complications or 3, anything, either it is minor or major, they will handle. But after a month, if I will go and ask that how many intradialysis complications, interdialysis complications have you handled? So they may tell approximately it is 50 or 40, like that.
Yeah.
Then if I will go in detailed, okay, you handled 50 approximately. Okay, so which patient got how many intradialysis complications? Then they will become in a question mark. Yes, I handled 50, but I don't know that for which patient, so how many intradialysis complications we got. And again, if we will go in detailed that X patient, this is patient A, so how many times he undergo hypotension periods during the dialysis, then again it is wondering, or else if they recorded accurately, they have to open the file, they have to go through the file, and they have to check in the last 1 month how many sessions we have done, how many times he undergo the complications. So it is like verifying the file and telling. So it is difficult nowadays to verify the file and to doing the analysis. Now we have to utilize the technology. We need to capture it in some form, and once we will capturing all these basic details daily, we have to note down either in the Excel sheet, or if we have the any EMR, electronic medical records, we are maintaining, so we can capture these things in the data. So with single click we can pull out all the data after a month or 15 days once. We can pull out the data and we can easily analyze that. So total how many complications has been occurred in the last 15 days or 1 month, and what type of complications. So out of total complications, what is the highest percentage of which complication is recurringly occurring in the particular center. Then which patient is profoundly getting again and again same episodes of intradialysis complications. So all these things we can find out. Once the problem is identified, then it is easy to focus on the solution. So if the problem is unidentified, then we can't look for any solution. It is like a open-ended question only. We never achieve the goal of eradicating the intradialysis complications completely. So this how we will work.
That's very insightful actually, because this comment comes from even senior people that, oh, accreditation or quality is only about recording, and my staff is busy and engaged in recording data all the time. I don't want that. I want them to attend to the patients. But what you have just said is so very important in understanding that data, when analyzed correctly and properly and in time, can actually save a lot of patient care that goes on behind the scenes.
Yes.
So I'm really happy you gave this answer, and I was not expecting it actually, because this is something that Ookalkar sir and I have at our heart. Data analysis, and we were famous at one time for Excel sheets. ये sir और madam सिर्फ Excel sheet भरवाते हमसे. Today you made it clear why the Excel sheet was being filled. So I'm really thankful to you for that answer. Let's go on to what you can do I have been to your unit and I saw that Chennai has a very hard water and there are a lot of impurities. And your unit has a double pass system. And I was surprised to see that. And I've only heard of this before because in Nagpur we have very soft water. So, can you tell us more about the RO systems that you have, how you maintain them, how you're designing them?
Everyone knows well about the value of water, how important and how value the water is in our life now. So especially when it comes to the dialysis, most of the very few people know how much water is required, but only the people who is working in dialysis, they know especially how many liters of gallons of water we are consuming to deliver the dialysis service. So in Chennai and different regions, the water is having the different, thing. Like in Assam, we are facing the challenge. So where the water we are having very high iron level content. In Chennai, it is different. So that's why before setting up any dialysis unit, first of all, we will test the groundwater. So to find out the elements in the water. So based upon the water source, so we will check the raw water quality. So based upon that, we will design the RO plant first of all. Then, and we make it a mandatory process that how much good quality is of the raw water. We will, in all our dialysis clinics, we are having the double pass RO systems. So to get the better output water quality, the almost the TDS levels of our final RO water TDS levels should be either 0 or less than 5. That is the all our plants in all our centers, that is the TDS levels that we will maintain.
0 to 5. Okay.
0 to 5. So because why we go for the double pass RO, first point is that, so even one thing is to get the better water quality. So we need to get the ultra pure water. So that because the quality of dialysis mainly depends upon quality of water input, what water we are using. So that is the main thing. Then second thing is whenever the raw water may changes, because every day the same parameters won't expect in the raw water too. So say after a month, suddenly the TDS levels might increase in the raw water from 200 to 300. So during that time also, because of double pass RO, even though the TDS levels may rise in the output of single plant, the second plant will reduce that, maintain the water quality as per the requirement. So that's why we will maintain the double pass RO. And the final thing, one more point is better in maintaining double pass RO is, even though we are having two plants, so if suddenly by emergency unexpectedly if the first plant goes breakdown, then we can't interrupt any services. We will use our second plant is already there in place, so we can, the services won't be interrupted and it will continue. So
Very good.
so because that's why we will maintain the double pass RO systems in every plant, and wherever it is required we will use the DM plant also. So multi-bedded plant to maintain the water quality, and wherever it is having the high iron levels, we are having the iron filters. So like that, the RO plant should be customized based upon the input water quality. It should not be standardized. That RO system in dialysis means it need to have one sand filter, one carbon filter and one softener. So the technicians has to understand it should be based upon the raw water quality we need to design.
So when you check for the raw water, what all tests do you do? I mean, do you do the standard army tests which are required? The whole.
We'll go with, we will check all the physical parameters like turbidity, the pH level, the color and everything. Then the chemical parameters, all the micro elements and macro elements we will check as a chemical parameters. Then we will check the microbiological parameters like bacteria levels and endotoxins, and everything we will check as per AMI standards.
Right. Now wonderful. Actually, some years back in Nagpur, we had lot of rains that year, and the water, the municipal corporation added more chlorine to the water, and so we had a very high TDS and very high chlorine levels, and some of the RO membranes were a little damaged because of that. I don't know, not properly maintained, and that was a very big learning exercise for us. So I'm glad you shared this, that the water has to be, the system that is there also has to be customized as per the requirements. we'll come to this point now that you have a team, you said, of 6 people,
Yes.
right? And you must be touring a lot. So
Yes.
your day and life as a quality manager, can you describe to the younger people how your day goes? How many meetings you have? What time do you start? Do you even end the day? Do you even go home? So
So,
can you share with us?
yes.
So typically, my day starts by morning 7 o'clock is sometimes itself by because of this WhatsApp. So whatever the issues, so we need to be work for 24/7. Yes. So the technology sometimes it will be good and sometimes it will disturbance also.
Okay.
So, but as we are in the healthcare sector, so we need to take it in a positive note. So we are there because we choose this field to serve the people. So we should feel it as an opportunity, and we have to take it in positive note. So once the morning 7 o'clock or 8 o'clock, once I will open the WhatsApp, the daily routine things will start. Like whatever is there any major issues in the clinics, they will ping in the WhatsApp. If it is a minor issues, if it is major issues, they will call immediately over the phones. Then that's how the day starts with me. Then once I will go to the office, then I will start checking to the mails. Then I will give the reply to the mails. Then I will start every day I will make the checklist. So what are the plan? See, as per my calendar, so I will make the points. What are the 5 things or 10 things today I need to complete? Either it is working on the meetings or the data analysis part or training programs to the technicians. So accordingly I will fix the schedule. Then I will start working it. In between, is there any meeting with the stakeholders? Then I need to attend those meetings with the stakeholders, R&M team, and with the COO, all these people, to discuss on the protocols, the processes, any major issues at any clinics, so that I will engage. Then I need to follow up with my team on how the things are going on in the ground level in the every region. So then that's how we will discuss. If any issues are there, we need to connect with the respective unit in charges, and we need to discuss on those parts also.
Okay. Nice.